Bismillah ar-Rahman ar-Rahim. I'm going to teach you one of special connective tissue in our body named cartilage. We know it's one of special connective tissue in our body. We have a prefix chondro. When we add to other terms, it means related to the cartilage. For example, chondrocyte, cyte means cell, means cartilage cell. The purpose of this lecture is to know the function of the cartilage at the end of this lecture, also understanding cartilage components, and also understanding different kind of cartilage in our body. First of all, we have the function of the cartilage, the major function of the cartilage. Because the cartilage is a tough and durable tissue in our body, it supports soft tissue in our body. For example, our ear and our also nose supported by cartilage, and also the respiratory tract, trachea, larynx, all of these organs in our body supported by a cartilage. Because the cartilage have a good resiliency and also have a smooth and lubricate surface, so in the joints it provides a gliding surface at the articulation and also in our joints. The cartilage provides a model for a formation. Most of the bones in our body during the fetus development, the first skeleton and the temporary skeleton in the fetus is composed of cartilage. Then this cartilage provide a model for bone formations and then converted to the bone and create our skeleton. And also the cartilage in the bone provide a plate called epiphyseal cartilage. These epiphyseal plates guides development and growth of a long bone and provide the longitudinal growth of long bone. Cartilage, like other connective tissue, should have three components: cells, fibers, and ground substance. The cells in the cartilage are chondroblasts and chondrocytes. The cartilage is only tissue in our body. The cells within the cartilage are related just to the cartilage, and we just have one type of cell within this tissue, and we don't have other cells within this tissue. In the cartilage fibers, we have a collagen type 1, collagen type 2, and also the elastic. And you can see the box of ground substance is bigger than two other boxes. It means the ground substance or extracellular matrix is very important in cartilage, especially ground substance. The cartilage contain a lot of and high amount of hyaluronic acid, protoglycan, and glycoprotein. And this high content of glycoprotein and protoglycans make cartilage as a ideal tissue for supporting and for bear any mechanical stress in our body. In this slide, you can see a schematic picture from the cartilage, the cell, fiber, and ground substance. You can see the cell chondrocytes in a group of cells, and you can see also the most important collagen in the cartilage, collagen type 2, associated with the other tiny collagen like collagen 9, and also a lot of protoglycans. You can see protoglycans gather around the hyaluronic acid. If you remember from the connective tissue chapters, we said a proteoglycan and hyaluronic acid have a high content of negative charge, and these negative charge absorb sodium ions, and these sodium ions absorb a lot of water, high amount of water. So in the cartilage, water bound to the extracellular matrix or ground substance or gags make about 60 to 80% of weight of cartilage. So this high amount of water in the cartilage make a cartilage function as a shock absorber. By compression, this water leave the cartilage extracellular matrix, and by decompression again this water absorbed to the extracellular matrix. Cartilage, like other connective tissue, originated from the mesenchymal tissue. You can see here the mesenchymal cells differentiated to the chondrogenic cells during the fetal development, and then chondrogenic cell differentiated to the chondroblasts, and chondroblasts start to produce the cartilage matrix and trapped within the cartilage matrix and converted to the chondrocyte. If we remove one of the chondrocyte from the matrix, we see a place without cells. This area called lacuna. Lacuna is actually the home of chondrocyte. The chondrocyte also is a very active cells and have a proliferation potentiality within the cartilage matrix. By proliferation, create other chondrocyte within the lacuna and also create isogenous groups. Isogenous groups is a number of the chondrocytes originated from the one chondrocyte within a one lacuna. Here you can see by a SEM, scanning electron microscope, you can see a picture from a chondrocyte within the lacuna, and also you can see extracellular matrix of cartilage. In the routine histological preparation, usually this preparation causes shrinkage, causes shortening of chondrocytes, and leave a empty area around the cells. This area called lacuna. But in a normal or in live situation in our body, usually chondrocytes completely fill the lacuna. Again, here you can see the chondroblast start to produce extracellular matrix, trap into extracellular matrix and convert it to the chondrocyte. And chondrocyte by proliferation create the isogenous group. Cartilage in our body lacks vascular supply or blood supply and nerves. So by the nutrition or the nourishment of the cartilage happen by a dense connective tissue around the cartilage. This dense connective tissue around the cartilage called perichondrium. Peri means around and chondrium means cartilage. So this dense connective tissue around the cartilage called perichondrium. This perichondrium bring blood vessels and also small nerve for the cartilage. But we don't have any blood vessel and nerve within the cartilage. And the nourishment of cartilage happen by diffusion of the nutrients from the perichondrium into the cartilage, and the waste material also leave by these ways and comes to the perichondrium by diffusion. So by the limits of diffusion or the limits of diffusion determine the thickness of the cartilage. Because of this limitation, usually we have a very thin layer of or thin plate of cartilage in our body. For example, if you see your auricle, you can see a very thin plate or thin layer of cartilage. By increasing the thickness of the cartilage, the diffusion, we make a problem for diffusions, and deep cell within the cartilage die because the lack of diffusions. I highlight here, you can see the precondium around the cartilage. When we magnify a part of precondium, you can see this part, precondium around the cartilage. The more outer layer of the cells, these cells usually are fibroblasts. But near the cartilage, these cells are chondrogenic cells, and at the peripheral part of the cartilage we have a chondroblast. They are elliptical shaped cells, and deep in the cartilage we have a chondrocyte. You can see some place, for example, like here or this part, you can see two cells in one lacuna. It means these are isogenous group. High content of glycoprotein and hyaluronic acids make the cartilage matrix basophil. It means usually it is stained by a hematoxylin, so it's a purple. But when we see around each lacuna, this place, is more basophil than intervening area, this part. The basophilic area, more basophilic area or more intense staining area around or immediately around each lacuna called territorial matrix. And intervening area between the territorial matrix, this part called interterritorial matrix. And we say territorial matrix is more basophil than interterritorial matrix. And the question is here is why territorial matrix is more basophil than interterritorial matrix. You can see in this schematic picture, this picture showed the collagen fiber in the matrix of cartilage. You can see around each lacuna we don't have any collagen fibers, but this area is rich of proteoglycans or hyaluronic acid. But when we get away from this area, we can see a lot of collagen fibers. So this part without collagen fibers is more basophil, but this area, in fact, the collagen fiber are acidophil, so neutralize this basophily area and make it lighter staining or lighter basophil area. So the more intense basophilic area is because of the high content of proteoglycan and hyaluronic acids. Again, in this picture you can see around each lacuna we have a territorial matrix, more intense staining part, and intervening area, interterritorial matrix. The basophily in this part decrease. Variation in the component of cartilage create three types of cartilage in our body: hyaline cartilage, elastic cartilage, and fibrocartilage. Hyaline cartilage is more abundant cartilage in our body. Let's see in which part of our body we have these three kind of cartilage. In this picture you can see hyaline cartilage in blue, fibrocartilage in red, and elastic cartilage in purple. You can see most of the cartilage in our body are hyaline cartilage. We have a fibrocartilage in a intervertebral disc and between two pubic bones called pubic symphysis, and also within the knee joint, epiglottis, and some other parts I will show in the next slide. And also in this picture you can see we have a hyaline cartilage in an airway passage in the trachea, bronchus, and also within the knee joint, epiglottis, and some other parts I will show in the next slide. And also in this picture you can see we have a hyaline cartilage in an airway passage in the trachea, bronchus, and other part of respiratory passage, especially the upper respiratory passage. In this slide I magnified the larynx. You can see the most skeleton of the larynx is composed of cartilage, and most of the cartilage here is hyaline cartilage, but some of them are elastic cartilage, especially the epiglottis, two tiny cartilage called cuneiform and corniculate cartilage. These are elastic cartilage, and the other cartilage are hyaline cartilage. Again, here you just can see the skeleton of larynx, epiglottis, cuneiform, and corniculate cartilage. These you can see in the green are elastic cartilage, the others in blue are hyaline cartilage. Again, the elastic cartilage we said we have in our pinna or auricles, the skeleton of pinna, in the primary part of auditory canal or the external part of auditory canal, and also you can see the skeleton around the eustachian tube. Is a tube connected the middle ear to the pharynx. The cartilage around these tubes support these tubes and to open during the time we need it. Let's start with the hyaline cartilage. Hyaline cartilage, again here you can see three components of cartilage: cells, fiber, and ground substance. The cells in a hyaline cartilage are chondroblasts, chondrocyte. The fiber here just collagen type 2, and the ground substance protoglycan, glycoprotein, and hyaluronic acid. Again here we have a high content of ground substance. The special glycoprotein in the cartilage is chondronectin. Chondronectin usually attach the chondrocyte to the extracellular matrix. A magnification of extracellular matrix of hyaline cartilage, you can see collagen type 2 and the space between the collagen filled by a protoglycans and glycoprotein. Again here you can see protoglycans and also hyaluronic acid. Usually the hyaluronic acid aggregate the protoglycan around itself. The more abundant protoglycan in a cartilage called aggrecan. Aggrecan is composed of a core protein surrounded by a lot of gags, usually the chondroitin sulfate and creatine sulfate. You can see creatine sulfate and chondroitin sulfate. Again, you can see a schematic picture from a hyaline cartilage. You can see precondium and cartilage. We said in the precondium we have a blood vessel and also the nerve that prepared nutrition for a cartilage, and somehow we can say the sense by a nerve for the cartilage. Outer layer is composed of the fibroblast cells. Near the cartilage we have a chondrogenic cell. Peripheral part of cartilage contain chondroblast, and deep in the cartilage we have a chondrocyte. Some chondrocyte in each lacuna. Some of them proliferate and create isogenous group. Somehow we can up to 8 cells within each lacuna. But some of them start to produce extracellular matrix and push away from the other cells and separate from the other cell and create itself lacuna. You can see one of them here create new lacuna and separated from the other cells. Territorial matrix, more intense staining area, and interterritorial matrix, lighter staining area. And also you can see the most abundant collagen in the cartilage, collagen type 2. Let's see in a real picture from the hyaline cartilage. Chondrocyte within the lacuna. You can see the lacuna. Territorial matrix is more basophil than other area. And intervening area between the territorial matrix called interterritorial matrix. Isogenous group and precondium around of cartilage provide nutrient and sense for the cartilage. Chondrocyte within the cartilage, we said they are placed within the lacuna. By proliferation they can produce isogenous group. Because of low oxygen tensions, usually they produce ATP or energy by anaerobic glycolysis. So they have a very limited metabolic activity, very low metabolic activity. And these cells proliferate by a hormone. This hormone usually produced by a pituitary gland, and this hormone called growth hormone. But usually the growth hormone indirectly affected the cartilage cells. First, the growth hormone affected the liver, and then the liver produced insulin-like growth factor or somatomedin. Then these factors affected directly the chondrocyte to proliferate. The next cartilage in our body is elastic cartilage. Elastic cartilage is essentially and structurally similar to the hyaline cartilage. You can see the cells are similar, chondroblast and chondrocyte, but in the fiber in the elastic cartilage, in addition to collagen type 2, we have a high amount of elastic fibers also in the elastic cartilage. You can see similar gran substance in elastic cartilage similar to the hyaline cartilage, hyaluronic acid, chondroitin sulfate and creatine sulfate, and also the chondronectins. But differences between the hyaline and elastic cartilage just is elastic fibers. A schematic picture from the from the elastic cartilage, you can see like a hyaline cartilage, we have a precondium here, fibroblast, chondrogenic, chondroblast, chondrocyte within the lacuna, isogenous group, territorial matrix, interterritorial matrix, and high amount of scattered, unevenly scattered elastic fibers within the cartilage matrix, in addition to collagen type 2. We cannot see the elastic fiber in a routine histological preparation. When we want to see elastic fiber within the elastic cartilage matrix, we should stain this fiber by a special staining, for example by orcine, this one kind of special dye, or by a resorcine fusion. It's another special staining for elastic fiber. In this slide you can see elastic fiber in a dark blue or in a purple by orcine. You can see elastic fiber scattered between the chondrocyte. The third cartilage in our body is the fibrocartilage. Actually, fibrocartilage is formed by a combination of dense connective tissue and hyaline cartilage, 50%, 50%. When we combine these tissue together, make a fibrocartilage. So, in the fibrocartilage, the cells are chondrocytes and fibroblasts. Fibroblasts for a dense connective tissue, chondrocyte for a hyaline cartilage. In the fiber, in addition to collagen 2 from the hyaline cartilage, we have a collagen 1 from the dense connective tissue. And also the more thickened collagen or more thick collagen in our body is a collagen type 1. So we have these collagen in a fibrocartilage. It causes the fiber parts, the fiber components occupy more part of or more portion of fibrocartilage. Because of that, you can see I show the box of fiber here bigger than the outer parts. And protoglycan and glycoprotein or ground substance portion here, because the hyaline cartilage is form 50% of this kind of cartilage. You can see formed a little part of this cartilage. A picture from the fibrocartilage. You can see the hyaline cartilage portion, dense connective tissue portions. The collagen type 1 occupy most mass of this cartilage. And again, this because of thickness of this collagen cause the isogenous group aligned between the collagen fibers. And in this cartilage, we don't have distinguishable precondium around this cartilage. A real picture from the fibrocartilage. You can see a lined isogenous group and dense connective tissue occupied by a collagen fiber 1. And some nuclear here, maybe it's a fibroblast like this one. Again, another picture from a young fibrocartilage, a lot of aligned isogenous group of chondrocyte, and between them you can see the collagen fiber or dense connective tissue. We have a fibrocartilage. Said we have this kind of cartilage in intervertebral disc. Each disc has two parts. Peripheral part is composed of fibrocartilage called annulus fibrosus, and core or central gel-like part called nucleus pulposus. Just in the disc, we have a peripheral part or annulus fibrosus is composed of fibrocartilage. The central part, it's not a fibrocartilage. cartilage. In a herniated disc, it's very common between the people. In this kind of person, because of lifting of heavy weight, you can see nucleus pulposus ruptured, annulus fibrosus, and go toward the spinal cord or spinal cord nerves and create a lot of disorders. During the fetal development, the first sign of cartilage differentiation in the mesenchymal tissue is retraction of cells extension, cell process. You can see the cells round up and start to proliferate and differentiated to the chondroblast. Then chondroblast produce extracellular matrix and separated from each other by a cartilage matrix. And after that, these cells trapped within the matrix create chondrocyte. Then chondrocytes proliferate and create isogenous group. You can see here we have a 5 chondrocyte within one lacuna. This cell called the isogenous group. Because of vascularity within the cartilage, we have a very limit growth in the cartilage. But this limit growth happens by two ways: a positional growth and interstitial growth. A positional growth involves differentiation of chondroblast to the chondrocyte and also produce of extracellular matrix and cause enlargement of cartilage from the peripheral part, from the local part. But in the interstitial growth, this kind of growth involves proliferation of or mitotic division of pre-existing chondrocyte. One chondrocyte by mitotic division create 2 chondrocytes within each lacuna, then start to create extracellular matrix and push away each other and create new lacuna and cause enlargement of cartilage. We have this kind of growth in an articular cartilage or joint cartilage. In the joint cartilage, we say the articular cartilage is kind of hyaline cartilage. All of hyaline cartilage have precondium except articular cartilage. I will tell you why we don't have precondium in this kind of cartilage in the joint in the next chapter. But here, because we don't have a precondium here, so this cartilage just have an interstitial growth, because a positional growth need a precondium to differentiation of chondrogenic to the chondroblast and chondroblast to the chondrocyte. So in the articular cartilage, we don't have a positional growth, just we have interstitial growth. Again, here you can see a positional growth, differentiation of chondrogenic cells or stem cell here to the chondroblast, then chondroblast converted to the chondrocyte, produce new extracellular matrix and cause enlargement of cartilage from the outer part or from the surface, from the peripheral part. But in the interstitial growth, here you can see chondrocyte by mitotic division create 2 chondrocytes, and each chondrocyte produce extracellular matrix and cause enlargement of cartilage. You know, the cartilage have a semi-solid consistency. So because of this semi-solid property, cartilage can be enlarged from the inside. Again, here you can see interstitial growth. And also, you know, we said we don't have a blood vessel within the cartilage. So we have a poor capacity of repairment in the cartilage because of its vascularity and low metabolic activity. When we have a big size of injury in the cartilage, and from the other side we have a poor capacity for repairment, the fibroblasts within the precondium in the area of the damage start to proliferate and fill the damaged area. So the damaged area filled by fibroblasts, not chondrocyte or chondroblast. And the most common situation you can see in the ear of a wrestler. Because of damage of elastic cartilage in the ear, because this damage is very severe, repairment happens by a fibroblast within the precondium and create a cauliflower ear. It's a very famous saying, and the wrestler have a cauliflower ears. Another disorder in the that involve the cartilage is osteoarthritis. Osteo means bone, arthritis means joints. This disorder is a situation, it's a chronic situation. It's happened during aging, especially in the most common or most using joint. For example, the knee, wrist, and the finger, and the joint in the finger usually involved by this disorder. In this disorder, by wear and tear, the cartilage that covered the end of the bone eroded and caused inflammation. And these inflammations cause swelling of joints, and after a while this inflammation causes deformity of the joint. Maybe you see this kind of disorder and this kind of deformity in the joint of your grandfather and grandmother hands. Okay, we finish the cartilage tissue.